The first thing people jump to when you mention inequality in the United States is education, jobs, policing. But what about healthcare? It's usually not the first thing on people's minds, but honestly, it should be. Because if there's any system that shows exactly how race, ethnicity, class, and history can shape people's lives and even their deaths, it's healthcare. But wait, before we jump into statistics and stories, let's ask a basic question. What does healthcare inequality actually look like? First, life expectancy, a statistic that almost no one talks about. According to the KFF, life expectancy for black people was about 5 years shorter than white people and nearly 10 years shorter for American Indian and Alaskan Native people. 5 to 10 years, an entire childhood, a whole decade of someone's life straight up gone. Not because of genetics, not because of individual choices, but because of whole communities that have spent generations dealing with worse living conditions, worse treatment, worse access, and worse outcomes, all because of their race. This isn't random. It's a pattern, it's predictable, and it repeats itself everywhere you look. But if we're being honest, inequality doesn't start in the hospital. It starts way before that. It's easy for people to say just get insurance, as if it's that simple. But where you live matters. Your state policy matters. In some states, especially in the South, they never expanded Medicaid, so thousands of low-income families fall straight into the coverage gap. But what is the coverage gap? It's where you make too much money for Medicaid, but too little for private insurance. Isn't that odd, huh? And guess which populations live in those states? Black and Latino communities. This is where small health problems turn into big ones. Preventable illnesses become emergencies, and inequality gets built long before you ever get to even meet a doctor. But here's the part that people really don't want to talk about. Even once you do get healthcare, the treatment still isn't equal. We all saw this clearly when we read Hood Feminism by Mikki Kendall in class together. Kendall didn't just talk about bias, she lived through it. During her high-risk 5th pregnancy, she began hemorrhaging at home. Her husband wasn't there, her toddler couldn't call for help. She had to navigate the emergency herself. And when she finally reached the hospital, she didn't get the life-saving care she needed right away. Later, when she spoke about how flawed her care had been, she wasn't met with compassion or love. She was met with harassment, judgment, and threats for the abortion that literally saved her life. Her story makes one thing extremely clear. The problem isn't just access, it's how people of color are treated once they get care. And this brings us to something even deeper, the history behind all of this. Structural inequality in healthcare didn't just appear out of thin air. It comes from generations of systems designed to exclude and devalue certain lives. In another text we read in class, Venus in Two Acts, Saidiya Hartman tells the story of an enslaved girl known only as Venus, a child who appears in history only through the violence done to her. She was tortured and killed on a slave ship, and the only record of her existence is a court case describing that harm. No childhood, no memories, no humanity preserved, just violence. Hartman's point is devastating. It was that some people were treated as invisible, unprotected, and completely disregarded. And when you look at modern healthcare outcomes, you can still see the shadow of that exact history today. The same groups denied protection in the past are the ones facing the highest maternal mortality rates, the worst access, the lowest life expectancy, and the harshest medical bias today. So now, what does healthcare inequality really mean? It's not just about who gets sick. It's about who gets listened to, who gets believed, who gets preventative care, who can afford treatment, who gets diagnosed early, and who gets dismissed. Ultimately, the harsh reality is, it's about who gets the chance to live a long, healthy life and who doesn't. And the truth is, fixing only one part of the system won't solve this. Expanding insurance won't erase medical bias. Better training for doctors won't fix access issues, and acknowledging history won't help unless we use that history to change the systems we have in place today. Real change means addressing everything: access, treatment, policy, trust, and not using race to determine whose lives matter. Because for many people in this country, the biggest threat isn't disease. It's the unequal system they have to navigate just to survive.